Hi, I'm Gail Smith, and I want to end the COVID-19 pandemic. So what does that mean? If the virus is moving faster than we are, it's winning. So how do you think like a virus? A virus loves it if people disagree and refuse to cooperate, because then it's got a lot of space to run around. We got to chase the virus, we got to outflank it, we got to encircle it, we got to shut it down, because if it can run around freely, what does it do? It replicates, it infects people, and it mutates. So we got to think about how we stop giving it space to do that. The US response to this pandemic has multiple pieces to it. First and foremost is getting safe and effective vaccines to as many people as possible and doing everything we can to increase supply. But there's also making sure that countries' health systems are intact, that they're strong enough that they're able to deliver vaccines and that they aren't pressed by the surges that may come with the pandemic. We're also responding to humanitarian needs all over the world. This pandemic has had a huge impact on people's health, but also on education, on the fight against HIV and AIDS, on jobs. Some countries have been utterly shattered by the economic dimensions of this pandemic and what it's cost them to shut down parts of their economy. And finally, we're working across the government to lay the ground for what's called global health security. That means ensuring that we and all countries in the world are able to prepare for, prevent, detect, and respond to the global health threats that we know are coming in the future. Part of our strategy is to work multilaterally and with partners. As President Biden has said, we will lead, but to get to scale, we can't do it alone. Doing all of this requires leadership, but it also requires everybody's participation. We need governments, we need citizens, we need multilateral institutions, we need the private sector, all of us. And trust me, when we all work together, we're a lot smarter and a lot stronger than any virus.